Good morning friends, I am Dr. Vijay Thakore. I am a senior vascular surgeon practicing at Baroda for last 25 years. I am glad to share few facts about vascular diseases which will help you in your day-to-day lifestyle. First of all, I would like to talk to you about varicose veins. Varicose veins means dilated, elongated and tortuous veins which is normally seen in legs, which is known as varicose veins. Varicose veins are commonly seen in female. That does not mean that varicose veins cannot occur in male, but when you look at the commonness, it is more commonly seen in women. There are different types of varicose veins. In our nomenclature, we normally say reticular varicose veins means which are veins like a spider web. Other commonly seen veins are saphenous origin veins, wherein the valves at the junction of deep and superficial veins become incompetent, means leaky, and thereby alters blood return or blood circulation. And third uncommon varicose veins are pelvic origin veins. Now, what causes varicose veins? Primary varicose veins by and large are genetic in origin. They are due to hormonal influences. They are not due to standing posture, eating some kind of food or some habits. It is a myth. People believe that varicose veins occur because of a prolonged standing, which is not true. It is true that because of prolonged standing, varicose veins might present or might see little early than other people. Secondary varicose veins means veins which are secondary to other problem like deep vein thrombosis or some kind of vascular malformations. So we need to differentiate the kind of varicose veins we are treating. Either it is reticular, saphenous or pelvic, primary or secondary. Now what are the common symptoms of varicose veins? Many times varicose veins could be asymptomatic. But those symptomatic people would present with dull aching pain, calf swelling, visible veins. In advanced cases, skin changes by and large black colored skin or eczema or non-healing ulcer. How do we diagnose varicose veins? Varicose veins many times is a self-diagnosis. People know that they have varicose veins. But to obtain some more detailed information about varicose veins, we should get color Doppler ultrasound, which is a simple, non-invasive, non-painful ultrasound of the leg, which tells us about the direction of flow, functions of the valve and involvement of different types of veins. So color Doppler ultrasound is very essential for diagnosis of varicose veins. What are the treatment options do we have? Not that all kind of varicose veins require treatment. Those reticular veins or spider webs essentially do not require treatment unless they bleed. In early cases or mild symptomatic patients, compression stockings or drugs like flavonoids and calcium dorbicillate might help. In symptomatic patients, these days we have non-invasive treatment options available called endovenous methods, wherein with different technologies like laser, radiofrequency ablation, glue, steam or a MOCA. By any of this modality, we close the leaking valve, we ablate the refluxing vein and thereby we treat varicose veins and prevent subsequent complications. What are the complications of this procedure or this operation? By and large, these operations are safe and very effective. Having said that, around 1 to 2% of patients might develop complications or consequences like deep vein thrombosis, nerve injury, skin burns, infection, etc. What are the consequences of untreated varicose veins? Varicose veins per se are not a serious problem. They do not create if they are not treated well, they may not end up with life loss or a limb loss. But if you do not treat them correctly in time, varicose veins might progress and person might develop kind of bad symptoms, severe leg pain, lot of varicose veins, venous eczema, non-healing ulcers, etc., which will alter their lifestyle and day-to-day activities. Many people ask that how do we prevent varicose veins? As I said earlier, it is because of a genetic influence or a hormonal disproportion. Unfortunately, it is difficult to prevent occurrence of varicose veins. If person undergoes an operation or an endovenous procedure for varicose veins, they do not need any special post-operative care. The advantage of these minimally invasive endovenous methods are that they can go back to the routine activities immediately next day after the procedures. They do not need any special precautions but to wear stockings for 6 months to 1 year time.